So I mean, he's got a pretty darn good alignment right now, all things considered. But you can see he still wants to.
However, this is the best alignment I've ever had. Then this shrank more.
Yeah, it atrophied even more.
And it atrophied. So my strength, what little strength I had in there is.
Yeah.
So he's always, just because of his being so short, he's always had some sort of knee instability with his prosthetics, and we've always kind of gone up pretty high to around his knee to try to get with the socket to try to get more stability out of it, but it's never been great.
No. And a lot of times I had a lot of errors in my walking too. So
yeah, and then when he spent so much time in bed, obviously he had developed that weakness, and he kind of continued to have like quad weakness afterwards as well. He found that like going, I remember you telling me that going upstairs was challenging for you.
Yeah,
Probably still is, right?
Since the accident, yeah.
Yeah,
Since my bed bound days.
And so, this seemed like it was kind of potentially the best of both worlds to be able to give him some of that extension assist, or at least the option to give himself some extension assist.
Yeah.
Okay.
Yeah, looks nice and snug.
Yeah.
It does. And it makes me wonder, because I've been just losing my balance more simply because I'm just not that strong. So now, but the question is, Nathan says I can do this. Do I wear pants with this?
Oh yeah, you can.
Yeah.
You think so?
Yeah.
And it's easy since that dial's unidirectional. You can do it through your pocket.
No, but I'm thinking of the width.
You're not gonna wear your skinny jeans with it.
I never have skinny jeans.
You are able to bend, and that might be one of the nice things about like something like this. Maybe not for you, but for some patients, like sitting down into chairs and getting up from chairs can cause a lot of strain on that knee joint, and to be able to kind of use the knee brace and instead of their knee musculature to kind of help them descend down and ride the brace down a little bit.
Yeah. I'm not used to relying on this at all.
Right.
But